Kabale district marked this year's World Diabetes Day with a grand celebration at Kabale Main Stadium, uniting community members, leaders and institutions to raise awareness about non-communicable diseases (NCDs) and promote healthier lifestyles. The event, held under the theme Empowering Individuals, Families and Communities for a Better Diabetes Life in Uganda, attracted a large turnout, including key leaders such as Kabale Municipality MP Dr. Nicholas Thaddeus Kamara, Deputy Mayor Kedres Mutawazi and State Minister for Trade, Industry and Cooperatives, Honorable David Bahati, who represented the Minister of Health, Dr. Jane Ruth Acheng. The celebrations kicked off with a 5-kilometer walk led by a band traversing the streets of Kabale town. The procession involved various groups including the UPDF, police, local leaders and members of the community. Institutions such as Rugarama Hospital, Rishoroza Hospital, Rugarama Nursing and Midwifery Institute and local schools participated in this initiative, which also featured free screening for diabetes, hypertension and sickle cell disease. Speaking during the event, Dr. Lumu William, president of the Uganda Diabetes Association, raised concerns over the increasing rates of childhood obesity, noting that 20% of children are now classified as overweight, thus elevating their risk for diabetes and other related diseases. He urged parents to prioritize healthy diets for their children and called for the establishment of a national diabetes registry.
We are having an increment in children who are obese. This is because of what we make them feed. They're eating chips, they're eating refined drinks from supermarkets, but even then, we go ahead and refine the drinks. We have seen an increment in the cases of people living with diabetes. The numbers have almost tripled. And this is because of the increase in the risk factors. We have just been told by the WHO that when it comes to Kabale, when it comes to alcohol, people consume lots of alcohol.
Dr. Charles Oyo, the commissioner in charge of non-communicable diseases, voiced concerns over the limited government funding for diabetes treatment, which despite the growing number of patients has not increased proportionally. He called for more investments in preventive measures to tackle the rising number of diabetes cases.
The cost of managing NCDs, diabetes, hypertension, but since we are focusing now on diabetes, let me talk about diabetes. The cost of managing diabetes is too much for this country. We cannot handle. The cases keep on increasing, yet the budget is more or less static or even reducing. Once you develop these conditions, you are always on medication for life. And for those who develop complications, the cost of managing the complications is too much, and we don't have the specialists to manage this in most of the facilities, save for the regional referral hospitals and at the higher levels. So the message today should be to prevent, and also to give hope to those who are living with diabetes that we have means to tackle diabetes.
Dr. Gilbert Mateka, Kabale District Health Officer, DHO, took the opportunity to address the rising trend of alcohol consumption in the region, which he identified as a leading cause of diabetes and other NCDs. He urged the public to reduce their alcohol intake and adopt healthier lifestyles.
The hard drinks are becoming so popular. It's trendy to be able to spend an evening and take a number of bottles of brand Y, brand X. It is trendy. If you are one of those who do not use them, you feel out of place. You feel out of place if you sit in an evening with a group of friends and don't seem to be picking on the bottle. I think it is important that we try to see how we change that. Then we are doing physical exercises, but then that side of alcohol consumption needs to be addressed.
Kabale Municipality MP Dr. Nicholas Thaddeus Kamara also spoke passionately about the growing concern of sugary drinks, especially soft drinks like soda, which are commonly consumed in the area. He highlighted that a single bottle of soda contains up to 12 teaspoons of sugar, a dangerous amount for one's health. Dr. Kamara also called for a stricter government measurement to encourage exercise, including limiting motor vehicle use in certain areas to promote walking and physical activity.
Ulongera umusoro kusha ariko awaraji, ulongera umusoro kusha ariko abia, ulongera umusoro nagani marwa. There are many drinks now on the market which are also having a lot of sugar. In fact, the highest sugar can be found in energy drinks. So there, Coca-Cola,
in her speech read by Honorable Bahati, Minister of Health Dr. Jane Ruth Acheng expressed her concerns over the rising rates of NCDs, which are currently the leading cause of death in Uganda. She called on local governments to prioritize awareness campaigns and emphasize the importance of reducing alcohol consumption, particularly in the Kigezi region, where it is a significant contributor to NCDs.
The costs of diabetes and non-communicable diseases to the country is high and it's increasing. That's the reason why we must work hard to ensure that we bring it down. But above all, the fight against non-communicable diseases begins with us. Each individual has the responsibility to fight this disease. Government only comes in to help you, to support you, but the most important thing is that you have the responsibility to fight this disease.
The Ministry of Health partnered with several organizations, including the Global Livingstone Institute, Bridge of Life, Rugarama Hospital, Rushoroza Hospital, and Kabale Regional Referral Hospital to make this event a success. This story was compiled by King Solomon Tuinamasko and Nobad Ndiamhachi for Kigezi Television.